As you know, vaccination does three things for us. Number one, it provides a shield against infection of the COVID-19 virus. Number two, even if the virus broke through the vaccination and you're infected, we hope it brings down the severity of the disease. And thirdly, being vaccinated, you reduce the likelihood of the person vaccinated to transmit to another person and slow everything down. And all three appears to be what is happening now in countries like Israel that has vaccinated a big proportion of their population. So when we went into the national vaccination exercise, the first phase has been focused on those who need it most, meaning vulnerable population that amongst us, and second, those in the front line, such as hospitals, seaport, airport, and teachers as well, teaching in the front line. And so for this group, we want to give them the maximum protection, meaning 2 doses. Yeah. And today, the progress has been good. So 1/4 of our population today are fully vaccinated, 2 doses. 1/3 has at least 1 dose. Yeah. So I think we are now approaching phase 2 of the vaccination exercise, and MOH has been studying what phase 2 should look like. And one possibility to think about this is that maybe for phase 2, we should try our best to give as many people as possible a good level of protection against COVID-19. That means give as many people as possible 1 dose of COVID-19 vaccination without reducing the effectiveness. And there has been many international studies, and it shows that even with 1 dose, it confers good protection without compromising efficacy. Yeah, 1 dose without compromising efficacy. So our scientists have been studying this. We have an expert committee, as you know, and the evidence locally and overseas point towards this, and immunologists around the world also express this opinion, that it is reasonable for those two actually to be further apart from dose 1. So instead of 21 or 28 days or 3 days, 3 weeks or 4 weeks, which is the case currently, it can possibly extend to 6 to 8 weeks without materially impacting the efficacy of the vaccine. So this will also be helpful given our current situation where we have more cases, and this is something we are studying. And once we are ready, not too long in the future, we'll announce the details, how we are going about doing this. But rest assured, if we do this, and when we do this, all those who already have your 2nd dose appointment will not be affected. This is a strategy for phase 2 of our vaccination exercise moving forward. Yeah. So I thought let everybody know this first while we continue our study, finalize the details, and once we are ready, we will put it out very soon.